Hi everyone, I'm Dr. Karam. I want to welcome you to my practice. First of all, I want to thank you for your interest. As you all know, my entire life's work is dedicated on facial rejuvenation, and the opportunity to help you look as young as you feel is at the foremost of this practice. And we take a lot of pride in the outcomes we achieve. People come to us because they want to look younger, they want to look refreshed, but more importantly, they don't want to look like they've had any work done, and they want to look like themselves. And that is the promise that we deliver every single day. And as a result of those beautiful outcomes and that type of consistency, we nowadays see between 100 to 200 inquiries come into our office every single day for the surgeries that we offer. And to make the entire process as easy as possible for you, we've decided to implement this pre-consultation process that will help you get to the answers that you want as quickly as possible. So let me tell you a little bit about how this process works and what to expect. So after we get done with this video, read through the different procedures very carefully. I'm sure you have an idea of the type of procedures that you are interested in, but the descriptions under those procedures will help you understand specifically what might be appropriate for you. Of course, by the time you have your consultation, we'll confirm all of that. There's a few things that I would like to highlight. The vertical restore procedure that is trademarked as a procedure is not a facelift. That's a very important point to highlight. It is a combination of procedures, namely a lateral brow lift, a mid-face lift, jawline lift, and a neck lift in a vertical fashion. It's a package of these procedures put together to give you the most maximum level of anti-aging correction and leave you looking very natural. Unlike a facelift, which is a horizontally directed procedure, that is a big point of differentiation, plus the fact that you don't have to separately plan on having a neck lift or a lateral brow lift is something that makes the vertical restore extremely special, but also the outcomes very powerful. The other point that I want to emphasize is the fat transfer, which we do in 90-something% of the cases, usually goes in tandem with the vertical restore, but almost always goes in tandem with any type of eye procedure. The fat transfers that I perform are not meant to augment or make the face bigger, which is a concern for a lot of people. It is just simply to restore some of the lost volume. I do roughly 8 or so fat transfers a week. I've done over 6,000 cases in my practice so far. The outcomes are always consistent, and they're always free of any lumps or bumps or any of these other things that you may have heard about. I just wanted to highlight a couple points. The eyelid rejuvenation procedures that we do are meant to reverse the signs of aging without changing the essence or the look of your eyes. And that is a really, really important part. And I know many of you are coming at this with a lot of preconceived notions of what facial rejuvenation can look like based on some of the unfortunate outcomes that you've seen in the community and on television and in celebrities, etc. But I can promise you this practice is completely different. This whole entire practice is devoted to your anti-aging and facial rejuvenation needs, and our entire team is dedicated to just that craft. So as a result, you are going to be in excellent hands from start to finish. So once you've had a chance to look through everything and you've had a chance to look at pricing, look at downtime, and other logistical information, if everything looks good to you, then you just need to submit your inquiry, which will ask you to submit your photographs and some health information. Our patient coordinators will look at everything very carefully, evaluate it, get back to you for a phone call or through email. And at that point, if everything looks good and sounds good, we'll set you up with a consultation with me, which I will look forward to helping you and confirming the procedures that you are already interested in, and we'll finalize the plan before surgery. So I hope all that sounds good, and hope this will help you get to your answers as easily as possible. And if everything goes smoothly, I look forward to meeting you for consultation down the road. Thanks so much.